Hi, this is Dr. Nick. I'm the Incrementalist here with incremental insights for better business, better health.
And I'm Fred Goldstein with Accountable Health here, helping employers, payers, and healthcare systems with their population health programs. So, Nick, we've spent a lot of time talking about a lot of the things you can do to keep yourself safe. You know, masks, distancing, better air handling, all of those. And vaccines, obviously, are the key here. But there's also been quite a bit of progress in terms of medical treatment. What's been going on that side?
Yeah, so I think one of the things that we're seeing is, declining rates of death in the hospital, even though we've seen a massive increase. And, big part of that directly, well, I don't know that you can directly draw the line, but I think we can intuitively say that vaccines are a big contributor to that. But we've learned, as we do with all diseases, about treatment options that work. And in the first or the very early days, we were really quite unsure. We were unsure about the ventilation characteristics. And, if you heard about people that were struggling with ICU and the whole ventilation process was not working, one of the things we learned early on was just proning, which is turning people onto their stomach so that the whole ventilation process is improved. That was a big improvement. We quickly learned that steroids, commonly used, very effective. I want to say convalescent plasma, which has long been around, and Diana Berendt, I think, from the Survivor Corps, if I recall, was the first individual she set up. She actually donated, she'd recovered. We take plasma from people and use their antibodies to help. Again, there's a limited supply of that. We developed some monoclonal antibodies. And now we actually have some antivirals in the same way that we have Tamiflu for flu, but we've actually got two. One that I think works extraordinarily well and can be given orally, which is a great thing. You can give that outside, so before anybody even needs to step in. There's availability issues with some of these. So Paxlovid and Molnupiravir. Let's hope I get those right. Somebody will correct me if I didn't. But and then we continue to explore, and we've gone down some blind alleys. I'm not going to mention some of the drugs that for me still I've seen no data to suggest that they are effective. The one that I think still stands out to me is the antidepressant. I think there's been some data that suggests that Fluvoxamine, which is an antidepressant, seems to have a positive effect. Again, I think we need data. But all of that, wow, look at what we've done and I'm going to say this is episode 95. It's 2 years in. So it is quite some time. But still, that's pretty fast progress for science.
Yeah, there are a lot of interesting areas to explore, and one of them would be just looking at this from a population approach. If they could figure out, in essence, what's the impact of the vaccines on the ultimate outcome as people get vaccinated, get sick, and end up in the hospital, as some do. And then what's the impact of the treatments themselves, which clearly there's been a fairly substantial one. When you look back to the original heyday of this in New York, and they were just overloaded with ICU patients on vents, and suddenly, as you said, discovered some of those early ways to change the treatment approaches that appeared to have profound impacts.
Yeah, I'm sure looking back, we're going to look at places like Italy, where, I think everybody saw this terrible picture unfolding. As you rightly describe in New York, we saw it, but then, things seemed to improve. I mean, it certainly got very bad, to be clear. And some of it was about applying the wisdom as quickly as possible and testing things out. I was a member of a WhatsApp group and a Google group that was set up specifically to sort of share insights. There was a morphing document of treatment options that clinicians were sort of contributing to, that I think was extraordinarily helpful to frontline staff. The challenge, and I'm sure some people are listening and going, well, why don't we just, we should know which ones work, answer your question. And, the reality is you can't do a trial and say, okay, these people we're not going to vaccinate, these people we're not going to treat, and we'll treat these ones. You can't divide up into this group from an ethical standpoint. So designing trials now is going to be very difficult to sort of tease that out, which is why we have to use some of these statistical tools. and some retrospective analysis of that data to say, can we find instances where we created those groups and then look at that data to be able to answer those questions, because they're great questions.
Yeah, and just as a quick aside on that, I noticed there was something recently on this issue that many of the impacts that people felt from the vaccine themselves were actually placebo effect, which is also something you couldn't do. Well, we're going to give them a placebo and we're going to give them the vaccine and then see the, but obviously when you first test it you can, but later on to get that sort of data. So it's interesting to see what are some of the impacts of this. The other area that's been fascinating is masks, and obviously we've talked about masks up to an N95. But you've mentioned it, there are masks that are better than that. Respirators, I understand it. And recently there was an issue with somebody wearing a respirator.
Yeah, so that was even Diana, who founded Survivor Court. She's very cautious. She's actually endured long COVID. She has gathered huge amounts of data and actually worked tirelessly and contributed to the convalescent plasma. She was wearing a full-on respirator. I want to say, if I try and translate it, and I'm not the expert in masks, but I think it went to the equivalent of an N97, I think somebody described it as. So it was even superior to the N95 mask. And she was wearing that. And unfortunately, in many instances, people have protocols that are dated and, are not equipped to establish that that is actually a superior mask. In part, one of the things that you see in many of the mask mandates is no masks with valves. And this particular mask comes with a valve. It's built in, but it's part of the valve that is for both in and out. And she was required to put on a surgical mask over it. Things didn't go terribly well, unfortunately. I'm always sorry to hear that. I think we can perhaps de-escalate things a bit better. We seem to have lost our capacity to sort of negotiate and do things, and have divided the seas almost. It's a bit like Moses. You're either on this side or that side of the ocean.
Right. And it's interesting because I purchased one of those years ago for working with some paints and some chemicals around the house that were pretty bad. And they have the screw-in, filters, and you can select really high-end filters,
Right.
but obviously the air has to go through it in that way, but it's designed to make sure that the exhaled air is not going straight out like a typical mask that might have a valve on it. So
Right.
it would be interesting to see if somebody might publish or put out some guidelines that expand up into that range and say this mask is okay to wear on planes, because obviously it's, as you said, superior to many others. I know that those fit really well when you put them on.
Yeah, you're not smelling anything, I'm just saying.
Yeah, exactly. Well, once again, it's been another fantastic week, Nick. Number 95, as you pointed out. If those listening would like to get more information, please go to accountablehealthllc.com.
And this is Dr. Nick. I'm the Incrementalist here with incremental insights for better business, better health.